Good evening. We breathe, we bleed, we cry when our patients die. We are doctors and we are human. The rigors of medical training has claimed many a doctor's soul and their lives. In fact, approximately 400 physicians commit suicide every year. That's 400 doctors kill themselves every year, and that's just in the United States. And those numbers, I understand, are an underestimate. 400 doctors kill themselves. This is not on CNN. Physician suicide has been documented since the 1858 in England. But we really don't have an organization that's tracking the number of doctors that kill themselves. The Surgeon General, Dr. Vivek Murthy, has recently stated that he is placing physician suicide on his agenda, and it's about time. It's about time that it's on somebody's agenda. Doctors are healers. We do this because we love to do it. And I think that when the soul of a doctor is so depraved and so broken that they're killing themselves, it should call to attention. We should stand at attention. So, this is a different kind of format for me. I'm usually pretty goofy, but we're talking about a serious topic here. And physician burnout is a term that's used to describe the reason why doctors kill themselves. And physician burnout can appear in a number of ways. Lack of motivation, lack of empathy and compassion, frustration, cynicism, depression. It shows up in so many ways. But there is no way that I can be the doctor that I want to be and usher you into healing the way that I am trained to if I myself am hurting and I'm not walking that place of healing. So taking care of the me in medicine really is taking care of you, essentially. So how do you do that? How do I take care of myself? I think it's really important to know who you are and what you like, what you don't like. So much of our training has caused us to be detached and compartmentalized that we don't even recognize ourselves sometimes. What do you like? What don't you like? What feeds your soul? What gives you joy? I love to sing, I love to dance, I love to act. That's me. That's the authentic me. And the notion that we have to fit into this box or this prototype is so damning and it's so destructive. It's not a healthy way to go. So I encourage other physicians who call me because they are on the verge of killing themselves, they're depressed, they're frustrated, they want to get out of medicine. I encourage them to reconnect with who they are. Then I ask them why. Why are you in it? Why are you a doctor? Why do you do what you do? What is the driving force? If you know your why, then the how and the what manifests itself. I'm in medicine because I love people. I love people. I love when the light bulb goes off and a patient recognizes that really they're awesome and they can do anything they put their mind to, and their diabetes is not all that they are, that they're more than their diabetes, and we can control your diabetes. We could do this. I love being a cheerleader and giving people hope. That's why I do it. I love going to places where people don't have a voice, and I can give them a voice, educate them on how to advocate for themselves in healthcare. That's why I do it. But I encourage other doctors to know why. Who are you, and why do you do what you do? Why are you in it? Once I know those two things, then I determine that I'm going to create the atmosphere of success. What does my atmosphere of success look like? And who's in it? So people and place and attitude. Success, I define. I define my own success. My success is not predicated on someone else's success or what it looks like to someone else. Okay? So who's in it? Build your community. I live on an island, yes, but I'm not an island. So I encourage people from all different walks of life. My community includes real estate agents, lawyers, other doctors, social workers, homemakers. My community is vast because they give me a different perspective, a way to look at things from a different vantage point. My community keeps me accountable. They love me and they encourage me to pursue the thing that I said that I want to when I explain my why to them. So I encourage other doctors to create that community, build that community, create that atmosphere and that environment of success, the one that you desire. Now, in my practice, I'm a little different. So I love, like I said, I love to sing, I love to dance, and so that's what I do. That's my environment, that's my safe place. And I found that so many times patients come in and they think that if they're just meeting me for the first time, that all I'm going to talk about really is the routine. Well, you have high blood pressure, I'm going to give you a blood pressure pill. You got diabetes, I'm going to give you diabetes medication. And most times we spend laughing, talking, connecting, and they leave feeling better. I'm able to do that because I'm connected to who I am, I'm comfortable in my skin, and I know why I'm doing what I'm doing. And so I'm a better doctor to them by being a good doctor to myself in a sense. So who are you? Why are you doing what you're doing? Create that atmosphere and the environment of success. Build your community, okay? Build your community. Now, we were trained as physicians to be superhumans, if you will. Those who have been trained know that there are times when we would go without sleep for hours. We call it being on call. And I have written many an order that I do not remember writing because you're sleeping. You should be sleeping, but you're in this state of awakeness and not being quite alert. I've decided that taking time to rest, decompress, and disconnect is vital to my mental health. It's vital to taking care of the me in medicine. So what things do I enjoy? I love to write. I love photography. You know, I encourage medical students, residents, and other physicians to get involved and figure out what feeds your soul. What is it that feeds your soul? Look, I went through a really tough period in my life. And in my counsel with my pastor, he said something to me that stuck with me and that I remind myself and I also remind my patients. Remember, through it all, do what feeds your soul. Situations around you are going to be chaotic, but you've got to take care of this here. And so I did. I reconnected with some of the things that I love, writing, traveling a whole lot more, and I reconnected. I decided that I needed rest. I needed to sleep. Sleep is so restorative. Our minds and bodies need sleep. Physicians, look, we are humans. We are humans, and yes, we answer the call and we want to save the world, but until we take care and nurture this only body, this is the only body that I'm going to have, and it's imperative that I nurture it and take care of it. Just recently, I experienced a couple things. Vertigo, which I'd never experienced before, and palpitations. My heart was just having a time, just the flip-flopping in my chest. And of course I get worried because I'm never sick. I've always been healthy. And I realized, I stopped and I thought, well, what have you been doing? You've been staying up late, real excited about, getting projects done and speaking, Austin, Texas, whatever, those other things that I do. And I had not been sleeping. I was getting maybe 5 hours of sleep a night. And my community, those people that I have garnished as my support, they came to me and they said, hey, are you sleeping? Hey, have you been to the, hey, and they kept me accountable. And so I decided that I was going to go home and go to bed, like leave the office at 5:30. I am going home, have dinner, in the bed no later than 9 o'clock. And I slept 8 hours. And my palpitations eventually, went away. But that was, again, a reminder to me. Even though I know these things, it was a reminder to me that I need to constantly remind myself of who I am, why I'm here, and to remember that nurturing and caring for me is important. Just recently, my patient this week said to me, Doc, we need you healthy, because if you're not healthy, you can't take care of me. And that really struck me because they get it. My patients get it. So, who are you? Why are you here? Creating that environment of success and safety, getting rest, decompressing, and refueling through doing your hobbies, just taking care of your soul is important. I have found that the notion of no is incredibly important to me. No is a complete sentence. It is noun, verb, pronoun, adjective. No. It does not need an explanation. It does not need an apology. It does not need justification. My no today means that my yes tomorrow, I can give you my yes tomorrow. We are expected to be everything to everyone all the time, and I can't do it. No doctor can do it. So saying no today, really, I'm saying yes to myself. And I think we ought to do more of that. Say yes to me. Lastly, it's so important to create memorial stones, I call them. Place reminders of your humanity around you. And this, while I'm speaking specifically about doctors, this is for any profession, whether you be a lawyer, an attorney, a lawyer, same thing, government minister, you're a teacher, whatever your profession, I think this applies across the board. But create memorial stones. This is a picture, actually, I love hummingbirds. Love hummingbirds. When I see a hummingbird, I think that God is like talking to me personally. That's my personal hummingbird. And so I took this here in St. Thomas with my Canon camera, and I chased the birds, kind of weird. If you see me, don't judge me, but I'm running around my camera, snapping. And this was one of the birds that I captured. But that I keep present because it reminds me of some of the things that I love. And that I know exactly when I took it. That's a memorial stone for me. This was when I first moved to St. Thomas. So that reminds me of who, why, what, etc. So create memorial stones, a living journal to remind you of your humanity. Being a doctor is a huge privilege. I don't take it lightly. It's a huge privilege because patients come in to a stranger's office and they share their most intimate details. They allow me to touch them in places that they would not normally have someone in public touch them. They allow me to hear their stories. They let me in. It's a privileged place. I consider being a healer a privilege. So I honor that privilege by taking care of the me in medicine. When I take care of the me in medicine, I am a better doctor to you. Thank you.